Hi and welcome. In this video we're going to be talking about how to properly place a Foley catheter in a female patient. So first things first, you need to make sure that your kit has all the supplies. Within this Foley catheter tray, we're going to find the Foley itself, the bag for urine collection. We're going to find a syringe to inflate the balloon. We're going to find iodine prep solution along with cotton balls and a pair of tongs. We're going to find lubricant. So those are the things that need to be in the tray. Sometimes there's a specimen cup for urine collection. So make sure that your hands are clean and that the garbage is close by, because the main point of the proper Foley catheter placement is maintenance of sterility at all times. Okay? So go ahead and take your kit. Make sure that your hands are clean. Introduce yourself to your patient and explain what you're about to do. Make sure that the patient understands that this procedure is going to be uncomfortable and that they should feel free to let you know if they're feeling any pain. So, the Foley catheter is wrapped in this drape. This drape comes with folds. You're going to use these folds to open up the sterile field, making sure that it doesn't close back up. So apply tension as much as you need to make sure everything is as sterile as possible. Okay. You're going to find a couple of drapes. The first drape is to keep the patient's bed dry. So you're going to tuck this under the patient. And make sure that your patient is positioned properly. Usually with males, their legs should be extended and relaxed, and with females, they will be in a frog-leg position. Tuck this underneath your bottom. You have a pair of gloves here. Make sure you carefully bring them out from the sterile field. It's indicated that this is the cuff end. So this cuff end is going to be towards you. You can use the patient's own body as long as you're able to control the placement of these gloves. It shows you the position of the thumbs. Okay? And then you're going to be covering the patient's perineum using the drape, the next drape. Take it out carefully. My hands are still clean and not sterile. You create a window. Okay? And now, this field is sterile. This field is clean. This field is clean, but the inside is sterile. So now we're going to prep our sterile area. Be sure to note that there are folds within the paper that encloses the gloves. Take hold of these folds, and if you open them, be sure that you open them with enough tension that they don't close back. Go ahead and pull them apart as much as you can to expose your gloves. The gloves also come with these folds. The outside of these gloves are sterile. Okay? And the inside of these gloves is clean and not sterile. So using your clean, sanitized hands, hold the inside of the glove and put on your first glove into your dominant hand. Take your time as long as you maintain sterility. Now we have our first glove on. and the outside of this glove is sterile. So I'm going to use outside to outside. Go ahead and tuck your fingers into the cuff of the other glove in this manner so that you can put on the next glove. Take your time as long as you maintain sterility. As much as I would love to clean this area up, I cannot touch this paper again because now my gloves are sterile. So I'm ready to access my sterile field. Position everything in a sterile fashion. You have your Foley catheter in the box waiting. Open the Foley. You can dispose of your garbage so you keep track of what's sterile. Prep your Foley, make sure it works, make sure that the balloon inflates. It just came off. It's not supposed to. Okay, and now that we know that it's working, we're going to deflate it. And wait. Keep the syringe locked in. The next thing you're going to want to do is to create your iodine prep and your lubricant. I will do the lubricant first. And then the iodine prep. Now, this is where it gets very important. One hand, your dominant hand, is going to remain sterile at all times, while the non-dominant hand is going to stabilize the structures of the perineum, the urethral meatus. Okay? Remember that as you're prepping your patient with the cotton ball, the side with the iodine prep will be prepping the patient, but keep in mind that the tongs should remain sterile at all times, as well as your hand, because you'll be going back and forth from the sterile field. Okay? So go ahead and stabilize the patient's labia with your non-dominant hand. With your index finger and your thumb, you're going to expose the urethral meatus just underneath the clitoris. And you're going to prep in a circular motion. Usually you can just kind of dab it. Three times. So you're making sure that the tongs do not touch your patient. Just apply a little bit of pressure. Maintain sterility at all times. And then again, prep the urethral meatus in the exact same fashion. Keep your tongs sterile. Hold the labia apart to better visualize the urethral meatus. you're done with your tongs, so you can dispose of them in a sterile fashion. Okay. Make sure you can see your urethral meatus so that your catheter does not bounce around. Take hold of your prepped catheter, lubricate it. So it's just after the balloon, because with females, they have a shorter urethra, and so you do not need to go all the way in with the catheter. Okay. Advance. Visualize the meatus. And take your time, making sure that the catheter glides in just past the balloon. And once you're just past the balloon, you can inflate the balloon. And your Foley catheter is in place, and you can break sterility. Here is your catheter bag. Make sure it's secure. Make sure that the Foley catheter is not kinked and that there is no tension on the urethra. And then dispose of your items appropriately. Great, and that's how you place a Foley catheter in a female patient.